Welcome to Learn Dentistry. Today's topic of discussion is Exodontia. Exodontia, as defined by Ho, is the painless removal of the tooth or root by causing minimal trauma to the investing tissues so as the wound heals uneventfully. There are different techniques for the removal of the tooth. First one is the intra-alveolar extraction. It is otherwise called as the traditional or conventional extraction, which uses specially designed dental forceps and elevators only. It is also called as the closed method of extraction. This method of extraction cannot be carried out if the root has some deformities like hypercementosis or if the root is brittle and also in grossly destructed tooth. The second technique of extraction is a transalveolar extraction. It is carried out by planning surgical flap technique with alveolar bone removal and tooth sectioning if required. It is also called as the open method for extraction. The third technique is the store-by technique. It involves the extraction of multiple mandibular anterior teeth using dental elevators. So these are the basic instruments used for extraction. First picture shows the extraction forceps, that is for maxillary and mandibular arches, and the second picture is of a periosteal elevator. The beak and handle of the maxillary forceps are 180 to each other, whereas for mandibular forceps they are of 90 to each other. Here are some indications and contraindications for exodontia or extraction. Indications include caries, periodontal diseases, pulpitis, periapical lesions, retained deciduous teeth, supernumerary teeth, malpose teeth, impacted teeth, tooth in the fracture line, and it is only if the teeth is responsible for causing an infection. If not causing any infection, it is not indicated for extraction. Contraindications are broadly classified into relative and absolute. Relative contraindication include any systemic conditions like heart disease, blood dyscariasis, bleeding disorders, etc. And also the physiological conditions like pregnancy, lactation, and also the old age. Absolute contraindications are those simple extraction, if ignored, may turn fatal. So, in any of these cases, extraction must not be performed. These cases are teeth within irradiated areas, within 6 months of MI after a bypass, central hemangioma and arteriovenous malformation, and in Haston's metastasis. Now we'll look at the operator's position and the angulation of dental chair while performing extraction. So the operator position for maxillary teeth is always in front of the patient, whereas in case of mandibular teeth, that is especially for the first, second and fourth quadrants, the operator should stand behind the patient. And for the mandibular third quadrant, operator should stand in front of the patient like in the maxillary teeth. For the maxillary teeth, the chair is tilted backwards and the maxillary occlusal plane is adjusted to 45 to 60 degrees with respect to the floor. Whereas for mandibular teeth, the chair is made straight and the mandibular plane should be parallel to the floor. Now we will see how and what should be the direction of forceps for each tooth in maxillary and mandibular arches. Maxillary central incisors, labial and mesial rotation. Maxillary lateral incisors and canines, labiopalatal and removal in the labial direction. For maxillary first premolar and first and second molars, buccopalatal and removal in the buccal direction. For maxillary second premolar, buccopalatal and rotational movement. For maxillary third molar, buccal movements and distal rotation. For mandibular anteriors, labiolingual and mesiodistal movements and removal in the labial direction. For first and second premolars, buccolingual and mesiodistal movements. Mandibular molars, that is the first, second, and third, buccolingual and mesiodistal movements. And removal in the buccal direction. Out of the maxillary arch, the most difficult tooth to extract is the canines and the first premolar. Why is it so? Because canine has more tendency to form a supernumerary tooth, and also it has the largest root and also the bulbous root. The first premolar, it has two roots, and these can be dilacerated or curved. And in case of mandible, it is obviously the mandibular third molar which is the most difficult to extract.